The very cruel side to one of the nation's greatest health challenges. Every 3 hours, someone in Australia loses a limb to diabetes. For 49-year-old Jeff Moody, life will never be the same.
I used to race motorbikes and I love life.
When he was just 18, he was diagnosed with type 1 diabetes. At 34, he lost all vision in his left eye.
Most blokes like me think it'll never happen to me. This can't happen to me.
But by 2010, he had developed what's known as diabetes foot disease.
I noticed one time on my big toes, some blood blisters occurred.
Those simple blisters led to utter devastation.
In the end, my foot ended up as a rocker, like it was bulging on the bottom, like I was walking on a rocker.
Jeff had developed Charcot neuropathy, a debilitating complication of diabetes, which results in disintegration of the bones and joints in the feet. Nerves are damaged and it can lead to a complete loss of sensation. Jeff couldn't feel a thing, and with each step he took, he was crushing the bones in his feet. By the time he took himself to John Hunter Hospital in Newcastle, it was too late.
One of the surgeons, orthopaedic surgeons in there, he said, mate, we're going to have to take your foot off.
How did you feel in that moment?
Oh, white, just incredible. No good. You know, you get up to think you got a leg there. Well, you don't, you know, and I was just smack on the floor and, you know, you're in the raw and you got nurses around you trying to pick you up. It's pretty belittling and brings you back to the grassroots.
Both type 1 and type 2 diabetics are predisposed to foot problems.
Once you have diabetes, the fact that your blood glucose levels are high itself is detrimental to your blood vessels and also to your nerves.
Like Jeff, when sufferers can't feel the pain caused by an ulcer or wound, it can be months before they go and see a doctor.
And by that time there's infection there, deep tissue infection including the bone, which is what often leads to amputation.
If we don't pick it up early, we end up getting quite a devastating situation, and it's pretty much guaranteed that you will end up resulting in having a below-knee amputation.
The High Risk Foot Clinic at the Royal Newcastle Centre has seen more than 400 patients in the last 12 months. In that time, 80 have had amputations as a direct result of diabetes. Over the past decade, there's been a 30% increase in the number of diabetes-related amputations in Australia. Doctors are desperately trying to combat the surge. But what's so heartbreaking is just how many of these cases are preventable.
It's estimated about 75% of amputations could be preventable with early detection, monitoring blood sugars, not smoking, and following just simple daily checks of your feet.
Do you look back now and regret you didn't take things seriously?
Oh, absolutely. And my biggest fault was probably checking my blood. They say you've got to check your blood at least 3 times a day.
As obesity becomes more widespread across Australia, the number of people with diabetes is rising rapidly. Health experts are warning that an inactive lifestyle, an unhealthy diet and high alcohol consumption all increase your risk of developing the disease. This disease does kill.
It does. It does. It carries a very high mortality rate. Those who have had an amputation is at risk of dying, and the risk is almost as comparable to cancer.
Jeff still grapples with the pain of his new life. He now faces losing his other leg and has been left with immense regret.
I should have pulled myself back into line, you know, many years ago. And I regret doing that because, you know, it's hard. You know, your life has to stop to manage your diabetes, to manage your life.
Stephanie Jeans, NBN News.